I actually knew before going into medical school that I was going to do pediatrics. I have worked with children since high school, and I actually coached competitive gymnastics here in Ames before medical school, and just loved working with the children and their families. Kids are so hopeful and so resilient, and it's so fun to get to watch them learn and grow and be a part of helping them stay healthy. As a pediatrician, I offer a wide range of services, including well checkups, acute visits if children are sick or get injured, and management of some chronic conditions, things like asthma, eczema, acne, and behavioral and mental health conditions such as ADHD, anxiety, and depression. A typical visit with me will always start with me introducing myself both to you and your child or children. After that, we'll talk about goals for the visit, if you have any questions or concerns. I'll typically examine your child, and then we will talk about treatment plan or next steps in plan of care. I think the most important thing when you're having a visit is making sure that the child knows that they have a voice and that they are an advocate for their own health. So I always spend some time getting to know your child and making sure that they feel comfortable asking questions during the visit. The most rewarding part for me is definitely the relationships that I get to build with both the patients and their families. I get to see kids from newborn babies go to kindergarten and then grow up and graduate high school and become adults. And I get to watch all of the accomplishments and milestones that they have along the way, and there's nothing better than that. So extraordinary care every day to me means making sure that you really know your patients, not just as a visit, but as a person. Making sure you know their likes and dislikes and what their goals and ambitions are, and really striving every day to give them the best possible care to help them reach those goals.